My name is Dr. Manuche Mazlumdust. I wish to express my opinion, and I hope some of my colleagues would agree with it and try to use that. I believe this suggestion may help many of coronavirus patients that they have a respiratory problem. First, let me introduce myself. I have been involved in medicine for 56 years. Out of these 56 years, 20 years I have been practicing anesthesia, which includes ICU as well as ventilators, which are, of course, a part of the ICU. I have been in the latest position at University of Kentucky, and I was assigned as associate professor at University of Kentucky, and I wish to express myself and say why I said high-frequency jet ventilation can be useful and benefit, and the advantages might save many patients. First of all, I wish to explain a little bit about the problem in patients of coronavirus, why they get respiratory problem, and this kind of complication kills many of them. One of the major problem in coronavirus patient is that they produce lots of secretions. This is not a simple problem, it's a very serious and dangerous and killing problem. The secretions, they don't come out easily because they get dry very soon, and they even get some of these secretions down to the alveoli and fills even the alveoli. And this is a major problem that kills many of these patients. However, this high-frequency jet ventilation, I emphasize the word jet because there are some other types, but this type is most useful in these patients when their problem is at the beginning or rather medium, and even when their problem is toward the end. Respiratory failure is a major consequence of these secretions, and doesn't allow the oxygen and carbon dioxide to exchange from alveoli to the bloodstream. Let me remind you about epidemic of poliomyelitis as well. In poliomyelitis, they invented a chamber. They called it iron lung, that they put the patient inside the chamber, and the head was outside, and they decreased and increased the pressure outside of the body of that individual. This negative pressure decreased the venous return and didn't allow the heart to do its function. However, secretions in the lungs of these patients, of coronavirus patients, are also similar problem, which fills the alveoli and airways, and the lung becomes very stiff. And when the lung becomes stiff, larger volumes, that is the essential for all other conventional ventilators, increases the pressure intrathoracic. And when the pressure intrathoracic is increased, it doesn't allow adequate venous return. Let's go back to the quality of high-frequency jet ventilation. This type of ventilator ventilates the patient 150 times per minute. On the other side, the tidal volume, which is delivered, is only 50, in contrast to conventional ventilators that tidal volume is 500. Why this is useful? Because when the tidal volume is 50 milliliter, it doesn't increase the intrathoracic pressure as much as 500, which is usual for conventional ventilators. And this difference make a big difference or big advantage. Because when the tidal volume is only 50, it kind of delivers the air in the matter of diffusion rather than convection, means moving a large volume. I'm referring to the 500 or 600 milliliter, which is essential for all other ventilators. This difference allows the air or other gases deliver in a manner which is referred to diffusion. In other words, the gases are not pushed very large amount at very severe increase in pressure. And this makes a big difference. On the other side, adjusting IE ratio, inspiratory to expiratory ratio, means although the time is in a matter of seconds, but still it makes a big difference. And when IE ratio is increased, it kind of like PEEP, P positive in expiratory pressure. And since the air is kind of moving down toward the alveoli more easily, it allows better oxygenation, and CO2 is moving much more quickly than oxygen. So anyway, the adjustment of this IE ratio, it does help with better oxygenation. It does help the heart also, because 50 milliliter on a lung which is stiff, and elasticity or compliance is very bad. This allows the cardiac output to be better, because venous return is not compromised as much, and venous return is very easily done because the pressure inside the thorax is not increased. And when the pressure inside the thorax is not increased, and venous return means the blood which comes out toward the lung is not going to go outside, and cardiac output is maintained in a normal amount, and cardiac output is not compromised. Because of these differences of this type of ventilator to conventional, it is the best for patients with this kind of problem. One other thing I would like to add to this qualification, and that is a device that I have invented. It's 5,072 726. This is December 17, 1991. This is the device that I have invented, and that is it. In this device, from here, anesthetic agents, which are furan and or isoflurane and ethane, is injected through here via a pump, and from here, the high-frequency jet ventilation is introduced, and these two beat at the inside of it. Here the gases are moving from this way or that way. Let me show you in this diagram. This one where these two are meeting at the center, the gases or anesthetics are mixed together. However, in this kind of device, which is for anesthetic agents, that is valuable, that's so good. However, if we are going to use this for anesthetic agents, that particular device, that one is useful. However, in this one, which is better for patients who are on ventilator, and these two, this one and this one are meeting together, and high frequency can change the water which is introduced here, and the water is supposed to be quite clean or distilled, not any salt or anything with it. It's going to go into very, very tiny amount. I'm talking about 1 or 2 micron. It's introduced through here. High frequency is connected to this one. Water is connected from here and comes here. These two mix together, and this way goes to trachea, and this one is the exiting of all the gases. Anyway, when this is happening, the secretions are diluted, and when the secretions are diluted, it can come out more easily. Physiotherapists are quite familiar. They do physiotherapy, and by vibration of their equipment brings the secretion from alveoli to the airways, and from airways come out more easily toward the trachea. It can make a big difference in patients who are moderate problem, who have moderate problem. But if the problem gets extremely severe, when all the alveoli and all the airways are filled, it may not be that much helpful, but I'm sure in many patients that their problem are moderate, it is going to be helpful. I hope physicians who are involved in ventilation, they should be encouraged to try to see this, and perhaps first we can do it in laboratory to get familiar with the problem, and then use it for patients. If there is any question, or even if there is criticism, I would welcome, some people would like to give me suggestions or even criticism. I would accept it. I would enjoy it, because I will correct these suggestions in future. My address is Wellward 101 North, that be right, capital N, Eagle, EAGLE, Drive, Lexington, Lexington. The state is Kentucky, KY. Zip code 40509. I would welcome everybody, and I promise you to try to correct or improve this discussion. However, I certainly hope my colleagues would try to use this. One other thing, I have prepared some information about intubation, and that is good for perfect anesthesiologist, because the second portion of this video is about difficult intubation, and the first portion is very good for all the nurses or even students or anyone who just have not started intubation and is not involved in anesthesia. They can benefit from those that I would introduce that on another section. I thank you very much for your attention, and hopefully consider using that in laboratory and get familiar and use it in patients who are in moderate problem or even severe problem. I'm sure they would benefit from this ventilator and diluting the secretions. Thank you very much.